Hi friends, in our pharmacology class we have been talking about a lot of drugs used for the urogenital system. So today we will discuss what is the frequency of urogenital drug use in ruminants and horses, right? So let us start. If you have subscribed to my channel GNP Sir, I'm highly thankful to you. If you have not subscribed, kindly do subscribe to receive the notifications very fast, right? So here are the contents of today's talk. We will be discussing about diuretics, urinary alkalizers, acolics, urinary acidifiers, urinary antiseptics, and tocolytics. Now, first we talk about the diuretics. Diuretics are substances or medications that promote the production of urine by the kidneys. And the clinical uses in cattle could be rare use in and mostly limited to addressing fluid retention issues like udder edema, pulmonary edema. In horses, they are occasionally used for conditions like EIPH or edema, with furosemide being the preferred choice. In dogs, diuretics are widely employed for managing heart failure and edema, with furosemide often combined with other diuretics in complex cases. Right? So this is the classification of the diuretics. They may include the osmotic diuretics, carbonic anhydrase inhibitors, phthalate diuretics, potassium sparing diuretics, aldosterone diuretics, mercurial diuretics, loop diuretics, xanthine derivatives like theophylline, aminophylline, and caffeine. But mostly, the most commonly used diuretic is furosemide, right? So here is a list of the diuretics, the example, the mechanism of action, and the clinical use. You can refer, you can download this lecture from the GNP Sir classes app where you will find it free. The potassium nitrate has been commonly used as a diuretic in pigs, cattle, and horses. It is administered orally in doses up to 30 gram per animal daily. Yet, this should be carefully monitored as it can result in nitrate toxicity. Furosemide is the most commonly used diuretic for cattle and horses. The dose is generally zero point 0.5 to 1 milligram per kg administered intravenously or intramuscularly depending on the condition being treated. In horses, the dose ranges from 250 to 500 milligram, 5 to 10 ml of a 5% solution given IV or IM once or twice daily based on the severity of the condition. In dogs, torsemide is often used to manage congestive heart failure and fluid retention. The typical dose ranges from zero point 0.1 to zero point 0.2 milligram per kg orally once daily, but this may vary based on the condition and veterinary guidance. You can download this PDF of this lecture through the GNP Sir classes app, the link provided below. Then we talk of the urinary acidifiers. Urinary acidifiers are substances or medications used to lower the pH of urine, making it more acidic. Examples are sodium acid phosphate, ascorbic acid, methionine, and ammonium chloride. Urinary acidifiers are rarely needed in cattle and horses, but are used in specific conditions like preventing urolithiasis in cattle, for example, ammonium chloride, or addressing urinary alkalosis in horses. In dogs, however, they are more commonly employed to manage or dissolve struvite stones using agents like methionine or ammonium chloride under the veterinary supervision. Then the next is urinary alkalizers. Urinary alkalizers are substances or medications used to increase the pH of urine, making it less acidic. Examples include sodium bicarbonate, sodium acetate, sodium citrate. Urinary acidifiers are rarely needed in cattle and horses, but are used in specific scenarios like preventing urolithiasis in cattle, example sodium bicarbonate, or addressing urinary alkalosis in horses. In dogs, however, they are more commonly employed to manage or dissolve struvite stones using agents like potassium citrate under veterinary supervision. Their usage is always tailored to the animal's condition and veterinary guidance. For sodium Bicarbonate in cattle, the dose typically ranges from zero point 0.5 to 1 gram per kg body weight, administered orally or intravenously, depending on the treated condition. For potassium citrate, the dose is generally 50 to 100 milligram per kg body weight, given orally. Next is the urinary antiseptics. Urinary antiseptics are medications designed to prevent or treat infections in the urinary tract by inhibiting the growth of microorganisms. Examples include nitrofurantoin, methenamine, nalidixic acid, and calcium mandylate. Methenamine, or mendalamine, or commonly called hexamine, has been typically administered orally to cows at a dose of 1 gram per 10 kg body weight for 7 consecutive days. It's important to ensure that the cow's urine is acidic for methenamine to be effective as a urinary antiseptic. However, methenamine should not be used in cases of renal insufficiency, severe hepatic impairment, or dehydration. For dogs, urinary antiseptics commonly include methenamine, which is administered orally at a dose of 10 to 20 milligram per kg body weight, typically twice daily. But for dogs, you can use nitrofurantoin as well. Now we talk about the acolics or oxytocic agents. Acolics are substances or drugs that stimulate the uterus to contract and promote the expulsion of its contents. Examples include oxytocin, ergot alkaloids, and prostaglandins. Then there are the tocolytics. Tocolytics are medications used to suppress uterine contractions primarily to delay preterm labor. The term comes from Greek word tokos means childbirth and lysis means loosening. Examples include isoxaprine, salbutamol, terbutaline, and these have been used as tocolytics in practice. So here is a table that we you can use for your study, and you can find it in the GNP Sir classes app, and you can learn from this table, which provides the drug name, the dosage for cattle, horses, dogs, and the clinical condition, the dosage, the clinical condition for which it is recommended. Right? So thanks for watching. Like, share, comment, and subscribe. GNP Sir. See you in the next video. Bye bye. Have a nice time. Bye bye.